The procurement in Thailand is one thing, the rollout in Thailand is another thing that we couldn't figure it out why we wouldn't be able to inoculate 10% of the population already when we start since the end of February. But today the CCSA has announced that they will involve more agencies in procurement of the vaccine so it can be faster. The COVID-19 vaccine procurements are expected to be expedited as more agencies will be involved in the joint effort. According to the CCSA new announcement streamlining the management of COVID-19 vaccines in Thailand. The announcement, which was published in the Royal Gazette yesterday, is to ensure access to the vaccines by at least 70% of the country's population, or 50 million people, and aimed at solving the host of problems which have beset the management of vaccines, which has come under heavy criticism from opposition parties, critics, and the public. The problems range from the monopolistic nature of vaccine procurement by the government, while the private sector is barred from importing vaccines, the limitation of current vaccines used of only AstraZeneca and Sinovac, the slow approval of new vaccines to delay deliveries of vaccines and reprioritization of vaccine distribution, resulting in postponements of inoculation appointments in several provinces. So under the new guidelines, detailed in the announcement, the procurement of vaccines is now the joint responsibility of Disease Control Department, the Government Pharmaceutical Organization, the National Vaccine Institute, the Thai Red Cross Society, the Julapon Royal Academy, and state agency responsible for providing medical and health services to the public. That's a lot of agencies together. But they have to work together to procure and import quality and effective vaccines which meet the standard requirements as a matter of urgency. So to improve public access to vaccines, private hospitals and the private sector may procure vaccines through the state agencies mentioned, but they must be approved for use in Thailand's Food and Drug Administration, and the prices charged by the public must be appropriate. If local administrations such as sub-district administration organization or provincial administration organization want vaccines for their people in their localities, they can procure them from the same state agencies in accordance with the regulations and vaccine management guidelines. So under the same guidelines, all public and private agencies are also urged to update information on the More Prom app. In related news, Julapon Royal Academy has revealed the price of Sinopharm vaccine. The shots will be 888 baht each. This price already includes shipping, storage, and side effect insurance costs. However, the price does not include medical service charges, which will depend on individual hospital. So this is the price of Sinopharm, 888 per shot. But if you are waiting for Moderna, I believe that yesterday the private hospital organization already announced that it will be 3,800 baht, includes everything, the insurance for side effect, the hospital fees, and the shots itself.